Greetings, everyone. Thank you for joining me today. My name is Commander Michelle Sangiorgi, and I am an emergency physician and lifelong student in the pursuit of continual daily improvement. Today, I would like to present a different approach to simulation and training as we discuss mindset training for improved performance. I'd like to review our objectives for today. First, I will talk about some background information and why I chose this topic. Then we will discuss what is mindset training and why it matters. We'll review two types of training, which is self-talk and visualization. And then I will demonstrate how we can use mindset training for medical and military training and performance. And finally, some future ideas and research. I'm sure that you have all seen or heard these items before. Navy medicine, focusing on KSA and performance. DHA, on a ready medical force and medically ready force. The Surgeon General, focused on the four pillars of people, platforms, performance, and power. CNO, also presenting consistent, strong performance and reassessment. And the most recent, Get Real, Get Better. These are not just buzzwords, but a mantra and philosophy to live by. They are all sending the same message. We need to take care of our people to make sure they are healthy and ready to deploy. We also need to ensure that each member of the team is confident and competent to perform the tasks that they are trained to do. But how are we meeting the mark? How are we training our people to be a ready medical force? What are we currently doing? We attend training courses such as ATLS, TCCC, TNCC, and all the resuscitation classes. We also attend CME lectures. We read books. We talk to specialists. We see patients. But what are we missing? We know that there is a gap between our knowledge and our training. There are just some cases that we don't see. There are combat-specific cases that we don't practice. HALO procedures, being the high acuity, low occurrence. How do we practice these? And how do we practice in limited resource environments? Well, we use simulation, of course. Medical modeling and simulation within the military is quite robust. As you can see, there are several partners associated across our network. We use our simulation centers to run codes or trauma drills. We focus skills with task trainers and create a safe learning environment to develop individual and team skills and performance. But we are limited by the staffing, funding, equipment and maintenance costs, and additional resources to implement and maintain the training programs and simulation centers. What if I told you there was an alternative method to help augment our current practices? We can use the power of the mind to help focus, prepare, and develop our skills in combat readiness response. We have the best simulation center available to all of us, medical and military personnel. It is available 24/7, has no limitations to its capabilities, and no personnel or equipment requirements. For years, sports psychologists have helped elite athletes train their minds and their bodies to perform amazing and complex tasks. Performers and other elite training teams have also learned the value and power of training the mind, controlling thoughts and emotions, preparing for missions, and decreasing stress and anxiety to improve performance. So why not prepare our medical personnel to acquire and maintain our skills, or our military members to prepare for combat? As we have learned on this course, we often need to look at what is happening in other industry to see how we can leverage and adapt our medical modeling and simulation. If it works for the best of the best athletes and highly trained military teams, then I have to believe that it can work for all of us. It just takes a little practice. I would like to take a moment to address how stress and anxiety can affect performance. In this first article, Anxiety and Cognitive Performance, published in 2007 by Eisnick et al., they discuss that anxiety focuses attention on the threat or the worry and decreases cognitive processing, therefore decreasing performance. Efficiency also decreased because more resources, namely attention, were needed to reach the same level of performance when not under that stressful situation. The second article by Dietz talked about how teams are affected by stress. It can be due to the individual team member that is responding to the stress, or it can be stress that is felt by the entire team. Regardless, they have found that increasing stress can decrease performance of all team members. For several years, the military has talked about increasing resilience and stress control through the Operational Stress Control Program. Other programs have been set up to focus on mindfulness and wellness. Why? Because it decreases stress. It aids in recovery and improves performance. Today we're going to talk about two types of mindset training, self-talk and visualization. Mindfulness training and tactical breathing are also fantastic techniques, but are beyond the scope of this talk. Please know that there are many different types of mindset training that can be utilized, and I'm sure that each one of you could find a way that works best for you. What is self-talk? Self-talk is a psychological skill using the words that we tell ourselves to direct our focus, our thoughts, and our actions to achieve goals or complete tasks. More simply, it's the words that we say and think to ourselves. Our words can be planned or they can be spontaneous. Planned, meaning that you intentionally are saying a word or a phrase before or during a task. Spontaneous, often emotion-based, or a thought that pops into your head when you're looking in the mirror. Your thoughts and words can be spoken out loud or in your head. They can be positive or negative, so be careful what you say. And they can be developed and practiced. The types of self-talk that we're going to discuss today are instructional, strategic, motivational, positive, or negative. Instructional or strategic self-talk is quite simply giving ourselves instructions before or during performance of a task or skill. For example, when placing an IV, first, I clean the skin with a ChloraPrep swab. Then I stabilize the vein, hold my needle at 20 degrees, and insert the catheter. Instructional strategic self-talk can be phrases or cues. When it's used strategically, it is basically the planned use of self-talk cues, usually before starting a skill or during a skill. Instructional self-talk is often used for fine motor, novel, or precision skills. This article listed below states the application of strategic self-talk in shooting stability and performance. Specific words or short phrases are said aloud or in the head just before performing a task. In this study, 40 sports science students were randomly assigned to an experimental group or a control group to evaluate the shooting performance of an air pistol and stability. The experimental group was instructed on how to do self-talk, using cues before shooting an airsoft pistol at a target. For example, loose trigger, shooting pin, elbows in. They were instructed to choose a self-talk cue and use it consistently before each shot for a week. The control group did not have any instructions to use self-talk and did their usual practice. Both groups improved the average shooting score, with the experimental group demonstrating a higher score than the control group. The stability of aim was also improved for the experimental group, but not for the control group. This study by Liu et al. Is another example of how instructional self-talk can be used to focus attention and affect performance. The thought is that each person has a baseline mindfulness state, either high or low, and that mindfulness is paying attention in a certain way to remain focused and present in the moment. Some say that self-talk is effective because it focuses attention. These authors wanted to know if mindfulness combined with instructional self-talk improved overall performance in high-pressure situations. "200 Chinese undergraduate students from a PE class completed the Chinese version of the Mindfulness Attention Awareness Scale. The authors selected the top 25% and the lowest 25% to represent high and low mindfulness states. 46 male participants were enrolled in the study. All participants performed the same tasks. They first used a two-hand coordination task, which used both hands to move a metal pointer along a star pattern. They repeated this 4 times. The first was no pressure and used instructional talk. The second was no pressure with unrelated self-talk on any topic. The third was pressure with instructional self-talk. And lastly, pressure with unrelated self-talk. Pressure situation was observation and evaluation by a research team member that was standing 2 meters away. After completing that, they repeated the exercise using a discrete task, in this case dart throwing, and they repeated the same 4 conditions. What they found was that participants had a poorer performance with low mindfulness predisposition and unrelated self-talk, which makes sense if one of the reasons for the success of self-talk and mindfulness is to focus attention. Both groups performed better with instructional self-talk under higher pressure conditions. And with higher pressure conditions, higher mindfulness students with instructional self-talk performed better. Overall, they determined that instructional self-talk is a cognitive strategy that can be used in higher pressure situations, regardless of the degree of mindfulness. Motivational self-talk is often more related to the emotional response. It improves confidence and self-esteem. It increases in arousal. Think about an elite athlete that's psyching themselves up before the game. It improves drive and effort as a person works towards a goal, and improves mastery by remaining focused on a current task and coping in challenging situations. For example, I got this, I can do it, and I'm always the best. These are ways that we can motivate ourselves. Motivational self-talk can also help to regulate anxiety. This study by Bellomo observed 45 novice golfers performing a putting task while using instructional and motivational self-talk. They reviewed their performance, technique, heart rate, and even EEG measurements of the alpha power. Instructional self-talk showed improved technique and alpha power, which suggested a top-down control of action and information processing mechanism. Motivational self-talk increased heart rate and decreased event-related heart rate variability, suggesting more of an effort-based mechanism. Finally, and probably most importantly, self-talk can be either positive or negative, and what we say to ourselves matters. This was a study of 258 female gymnasts, ages 14 to 20. They completed multiple self-reported questionnaires that were used to look at the athlete's perception of motivation, positivity, and self-reported contextual situational self-talk. These surveys were completed during a non-competition practice week, then repeated 20 minutes before a final competition and 5 minutes after the performance. The coach was also asked to assess the overall performance at the competition based on the athlete's usual performance. As you can see, positive self-talk led to more confidence and self-esteem, and improved and positive performance. Whereas negative self-talk led to increased anxiety and an overall negative performance. I think this makes sense. How do you feel when you say, "Yes, I got this, I can do it," versus, "This is so hard, I don't know if I can continue"? With the negative self-talk, we are more likely to not perform well or to quit. So let's take a moment to reflect on the power of our minds. We know that what we say matters, but what about what we visualize and imagine? Visualization and mental rehearsal is a form of simulation where a person imagines or envisions themselves going through the detailed steps of a process or performing a skill without physically doing it. Just like self-talk, visualization can be developed, performed anywhere, and repeated as often as needed. To make it most effective, the visualization should be specific, which means include as many details as you can imagine, or use as many senses as you can available to you. Why does it work? The human brain cannot distinguish between reality and non-reality. Have you ever had a dream that seems so real? It is a common theory that mental imagery may activate the same neural pathways used in actual performance. And the benefits of mental imagery or visualization is improved performance, decreased anxiety, and improved focus and confidence. Here are 2 examples of how visualization can be used to learn surgical skills. In the first one by Saunders, 64 second-year medical students were randomly assigned to an experimental or control group. Both groups learned how to make an incision and suture techniques via didactic and hands-on training. The experimental group also did a mental imagery session while the control group continued to read the textbook. Each group then demonstrated the incision and suturing technique on a pig's foot. 2 weeks later, the experimental group did another guided visualization session, and the control was instructed to read the book once more. Neither group performed the procedure at this time. 10 days later, both groups went back to the lab and performed an incision and suturing techniques on a live rabbit. What the authors found was that there was no difference in performance after the first imagery session. However, the experimental group performed better than the control group at the final incision and suturing demonstration after a second visualization practice, with no further hands-on practice for either group. Mental imagery was more effective in facilitating this transfer of skills required to perform the surgery. The same authors did a similar study using imagery technique for venipuncture and found similar results. As well, in that final study listed below, does mental imagery prior to cystoscopy make a difference? 68 residents were randomly assigned to an imagery group versus a textbook review prior to surgery. The imagery group met with staff attendings 24 to 48 hours before the planned surgery and imagined the procedure as they explained the steps in detail to the staff member. The session lasted less than 20 minutes. The text group reviewed the images of the text and also 24 to 48 hours prior to surgery and were instructed to keep the review session less than 20 minutes. The imagery group performed better and scored 15.9% higher than the control group and felt more prepared for the procedure. We can see that self-talk and visualization techniques improve performance and technical skills. So what is the way forward? How can we leverage these techniques in further medical and military skills training and simulation? Personnel in professions such as firefighting, law enforcement, and military must be able to respond effectively in acute, stressful situations that present a confrontational threat and are often ambiguous and offer little time to consider one's actions. This is a quote from a study done by Jensen and Reisberg in 2014. They interviewed 17 soldiers that have been involved in hand-to-hand combat to try to understand stress and coping frameworks during wartime operations. They found that hand-to-hand combat imposes stressors from several sources that require fast interpretation of the threat and rapid problem-focused response to this threat. It also invokes significant psychological and physiological reactions. They commented on the need for soldiers to expect the unexpected, to train in problem-focused coping strategies and physical skills, as well as training in variable and unpredictable situations. The consequences of emotional responses can lead to adaptive and maladaptive behaviors. This quote from Tenenbaum et al. Also suggests that we need to be able to regulate our emotional responses to improve performance. Each person has an individual zone of optimal functioning. What this means is that each person responds to anxiety and arousal differently with regards to optimal performance. Some may need to be completely relaxed to focus. Others may need to feel amped up or energized to perform well. The authors state that military must have emotional states and coping resources appropriate for the operation. In other words, a task-to-person fit. Each person also has an individual's affect-related performance, which is basically the emotional response to the stressor, and the perceived states based on the performance. For example, how the arousal level and perceived pleasantness or threat can affect the function and performance. These can be regulated and adjusted by self-talk, emotional control, imagery, relaxation, and attentional control. Imagery and self-talk can also be used as coping strategies in stressful situations to regulate the response and return the member back to their optimal performance zone. The authors also say that traditional coping strategies focused on problem-focused, such as goals, planning moves, anticipating actions, and emotion-focused, such as relaxation, meditation, self-talk, and imagery. Soldiers need to be able to do both. They need to control their actions and the emotions. Self-talk helps to get the person in the zone and feel prepared. Positive and negative talk affects performance. Visualization improves self-confidence and motivation. How do we use this in the future of medical modeling and simulation? Studies have shown that self-talk and visualization help to learn new skills and improve performance. We can use these independently or prior to simulated cases or task trainers to enhance learning and performance. We can practice the HALO procedures that we don't have dedicated equipment for or patient cases to practice our skills. Perhaps we can even extend the visualization to training teams as we walk through and talk through the cases with teams for a shared mental model and then practice a simulation scenario. By all means, it's not meant to replace current training, but it can certainly help to augment the training and maybe even maintain the skills that we're not exposed to on a routine basis. So in summary, stress increases anxiety and decreases performance. Elite performers train the mind and the body. Mindset training through self-talk and mental rehearsal can improve physical and mental performance and prepare for future events. The mind is the best simulation center. It is always available, has no limitation to its capabilities, no equipment issues, but it does require consistent maintenance. So get out there, positively talk to yourself about what to do next, and keep visualizing the future and developing your skills. Thank you so much for joining me today. I hope you have enjoyed this presentation.